Halftime brings us to the facilities here at Allied Services on the Morgan Highway in Scranton, and joined by a guest, Sondra Morgan, a physical therapist here. And Sondra pays particular attention to concussions, which is a topic that we're all aware of and certainly hear and see a lot about on a regular basis. So are we seeing more and more people come in for treatment of concussions over the past few years?
We definitely are seeing more patients coming in. I think there's a greater awareness out in the community and with physicians nowadays, and patients know to go to the doctor a little quicker than they did before with their symptoms, and the doctors are referring them for some concussion management of their symptoms.
But all this recent awareness and talk about it has really become a result of the science and more learning about what a concussion is and how concussions are diagnosed. So we have different ways of observing and seeing people with concussions now.
Yes, definitely. There are some very common signs and symptoms of concussion. Oftentimes, people that have a concussion will complain of a headache. They'll have nausea, vomiting, dizziness, balance loss, confusion. They lose their memory. They might not remember what happened directly before or after the event that caused the concussion. And some of these signs and symptoms might occur right after the concussion, but some of them might appear hours or even days later.
Okay, and so Allied Services is certainly devoted to treating and rehabilitating people with concussions, but what happens immediately when someone sustains a concussion? What advice would you give them for the immediate treatment?
Often what's recommended the first 24 to 48 hours is rest, and it means total rest of your brain. So usually what's recommended is to really decrease, we call it screen time. We don't want patients on their phones a whole lot, the computer screen, the TV, video games. They really need to give their brain a good rest. They need to take some physical rest as well. They shouldn't be playing their sport if they're an athlete for the first few days, and then they're checked out by their doctor. Sometimes what happens is patients might just recover on their own within 1 to 2 weeks. We tend to see patients here in the clinic usually after about 3 weeks, and they're still having some issues, some problem signs and symptoms at that point.
Okay, so after the immediate diagnosis and the rest, what is the rehabilitation like over the next few days and weeks if someone were to come in to Allied and get some sort of treatment?
Well, here we have a unique program for concussion because we can offer physical, occupational, and speech therapy to those patients. So under the physical therapy umbrella, we're helping them to decrease their headache. We can help decrease their dizziness through some visual tracking exercises, eye-head coordination movement exercises. We work on their balance and stability. We actually have a piece of equipment that we use that can address like evaluating their balance and training them on that piece of equipment as well. And the other aspect that they're having difficulty with is exercise. Because they're exercising and trying to increase their heart rate, that increased blood flow to the brain, their brain just can't handle it. So we need to determine, here in PT, what we can do is determine what's an appropriate heart rate for them to exercise at, what type of aerobic exercise they should be doing, and how to progress that program so that they learn to tolerate exercise again. So, through the rehab process, if they're an athlete, we might incorporate their sport into their treatment. If it's an adult and they need to go back to work, we can simulate maybe their work environment, or if recreation is their goal, maybe a recreational activity. The occupational therapist, they're going to address more of the vision difficulties. So patients that have had a concussion will have difficulty with double vision. They can't track words across a page. They have problems with motion, like observing motion and watching moving objects. They're very motion sensitive. So the occupational therapist has a special computer that they use for vision therapy and different optical equipment that they can use as well to help improve visual performance. And then the last piece is the speech therapy, and they address the cognitive difficulties that a person is having after concussion. So they have memory loss, learning and attention problems, multitasking, organization and planning. They have difficulty with all of that. So they'll address those issues and help them to compensate for those difficulties.
Okay, so very important to get those concussions treated follow up with the rehab to avoid the lingering effects of a concussion over a period of years. Thank you to Sondra Morgan, physical therapist here at Allied Services. We'll be back with more basketball. You're watching Allied Services High School Hoops on MY TV WQMY.